Good evening, Los Angeles, and thank you again for joining me here this evening at Los Angeles City Hall. And I want to say that we're very pleased to be joined tonight by a special guest and a woman who has been really the face of public health here in Los Angeles County and guiding us during the toughest times that we have faced collectively as Angelenos, Dr. Barbara Ferrer. I want to thank her for being here and thank her for all that she has taught us, all that she has informed us, and the grace and intelligence with which she has led during what has been unspeakably tough days and tough ones ahead. Dr. Ferrer and the entire county have been amazing partners for all of us that are Los Angeles County residents. Together with the Board of Supervisors and county leadership, they have ensured that 88 cities and unincorporated areas of LA County are all together and conversing with the counties around us, really part of a 19 million person metropolitan area called Southern California. And I look forward to hearing more from her this evening about the work that we need to do around telling the difference between masks and protective facial coverings. And I want to thank her for coming down. We usually speak on the phone during the day. We're practicing ourselves safe physical distancing, but we thought it was important for you to hear from her this evening in this address as well. Over the past few days, we've all seen a rush of difficult news. We've seen projections of COVID case numbers, fatalities, and economically, we've seen this country set a very dark record with another 10 million Americans filing for unemployment in this past week. The list goes on. And it can feel sometimes these days like there's no end in sight. But together, we know how strong we are, how we can get through this together, how we will march through this fog together to the other side. But I can tell you without hesitation that the determination and the ability of our collective Los Angeles will make sure that these days will one day be behind us. It starts with staying safer at home. And I know I say it each evening, but thank you. Thank you for doing your part to make sure that lives are saved by the actions that you take. And the more that you take them, the quicker this will be, and the fewer lives will be taken. And the less that you take them, the longer it will take, and the more lives we will lose. Supporting our local businesses through this and those workers that are on the front line, whether it's our restaurants that you're ordering from, or some of our first responders and clerks and others who are ensuring that we can not only stay put at home, but that we can prosper at home as well. As usual, let me begin tonight with data, a snapshot before moving on to some announcements and updates of our ongoing work. As Dr. Ferrer announced earlier today, the numbers in Los Angeles County are the following: 534 new confirmed positive COVID-19 cases, bringing the total number to 4,045. This was a 15% increase from yesterday. This is the second highest number of cases in a single day, but as you remember, these will compound and we will have large numbers. In the city, there were 207 new cases, bringing the total to 1,717, a 13% increase. We learned, most tragically, of 11 new deaths, bringing the total number of deaths in Los Angeles County to 78, which is a 20% increase over yesterday. The county's total number of deaths has doubled every 4 days. And every time we lose another Angeleno to this virus, every time we hear those numbers, we know they're not just numbers, but as Dr. Ferrer often says, these are people. And for so many of us, they are our loved ones, our family members, our neighbors and coworkers, and our hearts break with each one of you who is mourning the loss of someone tonight. And we're going to keep trying to get ahead of these numbers by ramping up and scaling what we can do with testing. We have testing going on through hospitals and providers, and today through the City of LA and now County of LA sites, we conducted 2,100 tests, bringing the total number of Angelenos who have been tested so far through these sites to 14,400. Additional about 23,000 people have been tested through other providers, through LA County's Public Health Lab, so about 37,725 people have now been tested county-wide. By next Wednesday, we'll double our capacity in those city and 3 new county drive-through centers, and 30,000 people will have been tested through those centers alone. And combined with other ongoing testing, somewhere between 50 and 60,000 LA County residents will have been tested by the end of next week. We're up to 9 different locations, including 7 within city limits, And we're adding more slots every single day. So you don't have to live in the city of Los Angeles to be tested. For any of you that are listening from any of the other 87 cities or unincorporated areas, please go to the portal at coronavirus.lacity.org. And even though it says LA City, it's not just for LA City residents. That's coronavirus.lacity.org to see if you're eligible to get tested and to sign up. And remember, if slots are filled up for a particular day, you can make a future appointment as well. To slow the spread of the virus, we have to stay in our homes. Many folks are, and now with restaurants now exclusively serving takeout and delivery, that shift means that we need fewer parking spots, but more quick loading zones. So tonight, I'd like to announce that our Department of Transportation is launching a new service to install temporary food pickup parking zones near restaurants. We want to do everything to keep these restaurants alive, and I encourage you, order from a nearby restaurant. But I know the lack of parking was chasing some customers away. And for workers who are doing the pickups and deliveries, it is critical to make sure that they are safe and they have a place close by. So new signs will be supplied, installed free of charge, near restaurants and other food providers that apply and get approval. And it's easy to do. You can find the application at ladot.lacity.org. That's ladot.lacity.org/pickup zone. Looking at our streets, we've seen another noticeable change. Since the Safer at Home order, we've seen a decrease of 59% in all traffic collisions between the first half of March, before the order took effect, and the 2 weeks following our directive. Statewide, a new study shows that vehicle collisions have been cut in half. It's a small sample size, and we're acting to make our roads even safer by setting traffic lights to a late-night schedule with more frequent red lights to slow drivers down. And let me please ask those who are driving, because you are a critical worker, or if you're going to do critical work like getting food, slow down. There are a lot more people walking and biking, and just because there isn't traffic, that's not an excuse to break the speed limit. It's good news to see a drop in our traffic injuries and deaths in our neighborhoods. This is also freeing up hospital beds that we will badly need for the days ahead, and emergency personnel from responding to fewer traumas. And that couldn't be more important right now, because across the county in our general emergency hospitals, there are 1,664 available beds, including 305 ICU beds. There's also an inventory today of 1,050 available ventilators. For those of you who follow these numbers closely, those are increases in all of those categories since yesterday, even as we have new people coming into the hospitals. That speaks to the heroic work that's being done in county hospitals, in nonprofit and private hospitals, everybody who is building that capacity. And I want to thank the county and our hospital association for the work that they are doing to make sure that we have more beds for the cases that are coming. It's still insufficient, though, and so we're continuing to work to find more ventilators, to work with hospitals for more beds, to work at the convention center and other places where we can make sure people can go. And as more and more COVID-19 patients stream through our hospital doors, we're going to continue to work with our medical community to find innovative ways to expand space to make sure we can take in as many patients as possible. And the arrival, of course, of the USNS Mercy was a critical step. But as we learn more about COVID-19, we are constantly updating guidance and orders so we don't just flatten the curve, we try to get ahead of it. Last night I announced that we're recommending in the city of LA that we recommend Angelenos use homemade face coverings when you're in public and when you're interacting with others. Data shows many folks who are infected are asymptomatic and can become super spreaders, infecting people they come into contact with. And together with physical distancing and staying at home, adding a protective face covering is another tool to slow the spread. We want you to keep your respiratory droplets to yourself. And that's what a protective face covering can help do. Now, notice I haven't called them masks. That's because N95 and other medical grade masks like surgery masks are reserved for medical workers like doctors and nurses. And using an N95 mask yourself, if you're not one of them, could cost a doctor or a nurse their life. The non-medical face coverings you should wear in public, they can be made from bandanas or scarves, things like this that you have at home, folded. We're seeing all sorts of amazing, innovative ways where people can take just a simple scarf and a couple rubber bands and make your own, or order them online. We've been working with tremendous companies here, as I mentioned last night, 5 million of which will be manufactured of local non-surgical face coverings for folks to use. And this is not an excuse, by the way, to break out of the stay-at-home order. Now that you have a mask on, it's not time for you to go out and to break the rules or to head to a park that is closed or to go to the beach. That's not the point. It's when you are out in public already today, getting groceries, pharmacies, other essential stops. Protect those workers, protect the delivery workers, and protect all other non-medical essential workers when we interact with them by wearing that face covering. Those essential workers listening now may be asking, what should I do? And that is also to cover your face too. And for grocery workers, I'll be announcing protective measures in the coming days. But to tell us a little bit more, don't take it from a mayor, take it from a doctor. I'd like to ask Dr. Barbara Ferrer to come forward and speak a little bit about the difference, the importance of masks, and what facial coverings can do as well. Dr. Ferrer?
Good evening, and thank you so much, Mayor Garcetti, not just for your leadership on this issue, but I think for bringing together the entire community here of Angelinos in this county. I also want to thank the Board of Supervisors and all of both the city departments and the county departments that have mobilized and cooperated effectively across all kinds of jurisdictions to make sure that what we're offering here across the entire county is really a coordinated, effective response that will slow the spread. But mostly, I want to thank all of you. I join the mayor in my deep appreciation, actually my awe at the sacrifices that everyone's making, the big changes that people are adapting to, the enormous amount of risk that our essential workers are taking when they go to their jobs, whether they're working at our grocery stores or they're frontline at the hospitals or they're our emergency responders and public safety folks. We know how hard it is to try to balance the work that you're doing that keeps the rest of us able to function with your other obligations. And my heart goes out to you, and I'm deeply, deeply appreciative of everything everyone's doing. But as the mayor says, we're in this together, and if we all do our part, this will be a little bit easier. And if we're not all able to do our part, it will have tremendous implications in our community, both in terms of the increase in the number of cases that we're going to see, and also, unfortunately, the increase in the number of people that lose their lives. And to all of you who either are praying for or caring for people who are sick with COVID-19, or you've lost a person to COVID-19, please know I keep you in my thoughts and prayers every day, and I share your sorrow at the loss of life. But I do know that we're brave, and I do know that there's another side that we're going to get to. But I do want to talk about what it's going to take to get to the other side, and I think the mayor spoke really eloquently and thoughtfully about where we are right now. And I think from where I'm standing, we have seen an increase in cases every day. We've seen the corresponding increase in the number of people who have died. And fortunately, thanks to the superb efforts of so many at the city and the county, we've expanded our capacity to test, which is really an essential part of our ability to actually take the protective actions we need. And I say that because if you're a person and you've tested positive, at this point you know what you need to do. Self-isolation is vitally important, one of the most important tools we have in our toolkit, and it really means that you stay away from everyone else. You do your best in your families. I know situations can be crowded, but you do keep yourselves apart. You're not caring for other people, you're not preparing meals, and you're certainly not leaving the house. You do need to stay isolated for at least 7 days, and 3 days have to be symptom-free and fever-free. So if it takes a while for you to recover, then please stay self-isolated for the entire time. And for everyone around you who was a close contact, we ask that you quarantine. And that means you too need to not be out and about. You too need to stay away from others. You need to stay home. You need to arrange for others to help you get your groceries, get your medicines, because you cannot leave your house. It's vitally important that we slow the spread by taking these actions that really limit the possibility of exposing others to the virus. And why has this become more essential? Because as we're gaining more information and we're learning that, in fact, asymptomatic people may also be infectious and capable to spread, this idea of staying apart from others becomes central to the work that we're doing. And the social distancing, the 6 feet, it's not really an arbitrary number. 6 feet is sort of the average distance that your respiratory droplets can go. So whether you're coughing or you're sneezing or you're just talking and respiratory droplets are coming out of your mouth, they're not going to travel on average more than 6 feet. So you keep your distance, and it really helps limit the ability of other people to expose you to the virus. But now you also need to take responsibility for trying not to expose others. And besides staying home and washing your hands often, making sure you're not out and about when you're sick, it's now really a recommendation that you too can cover your face, and by that I mean your nose and your mouth, when you go out. It doesn't protect you, but it does protect other people. But we ask that you use a homemade face protection, nose and mouth protection, and not go after the limited supply we have of what we call medical masks. And I'm going to talk about why in a second. The kind of protection you're looking to do is to make sure that you, as the mayor said, keep your respiratory droplets to yourself as much as possible. And by wearing a face mask when you're out and about, particularly if you're going into public spaces where you might run into other people, is a good idea at this point. It's something that a few weeks ago we weren't recommending because it wasn't clear that there was a lot of spread by asymptomatic people. So when we told sick people to stay home, it really was our way of limiting contact. But if there is asymptomatic spread, and even if it's just a small amount, it's worth us taking that extra step. So we do urge you, when you're out and about, cover your nose, cover your mouth, use a homemade mask, or purchase a special homemade face covering, or purchase something that's especially made for the general public. Because I want to talk about the difference between what you're being asked to do when you cover your nose and your mouth and what our healthcare workers need to do. Our healthcare workers are wearing protection through either an N95 mask or a surgical mask to protect them from other people. That's very different than what we're asking you to do, which is protect other people from you. They need to be protected from sick people, from people that they're caring for. And the best way for them to do that is with the appropriate personal protection equipment. There isn't a single person in the general public that needs an N95 mask. These are fitted masks. They're really only needed for people who are performing certain procedures in a medical setting or in a first responder setting. So please, 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 I beg you, don't go and look for an N95 mask. They're in short supply, and we have to make sure that our healthcare workers are able to access them and have them so that they can continue to protect all of us and provide us all with services when we or the people we love are sick and need health care. Surgical masks are also in very short supply. These are masks that are used by many other essential workers, including healthcare workers, who don't need an N95 mask, but will be coming in contact with people who could be sick and could be infectious. These are people who work at our assisted living facilities, at our nursing homes, at our shelters. These are people who work in some of our congregate feeding programs, and these are people who are doing home visiting of often very frail and medically ill people. They have to have a surgical mask. So again, I ask you, please don't go and purchase surgical masks. Please don't go and purchase N95 masks. These are so that people who are providing vital services are protected from the people they're caring for. And your purpose in putting a face covering on is so that you can protect others. So it's a big difference in which mask and face covering you need to use. And I ask that you help us and that you help make sure that our healthcare workers and our essential workers can do their jobs protected to the best of the ability that science allows us to do now. So I want to thank everyone. I particularly want to, again, thank Mayor Garcetti, thank the Board of Supervisors, Supervisor Barger, the chair, and thank all of you. I know that together we're going to go through some very tough times, but I am really feel really blessed that I'm able to work with all of you, and really thankful for all that you're doing to do your part. Thank you and good evening.
Thank you so much, Dr. Ferrer. Thank you for being an angel in this city of angels. And I know for everybody who's out there, your guidance has been so amazing to all of us, as well for the health professionals. And thank you for making that distinction yet again. We should all cover our faces, so get creative and share how you are doing that. As I said last night, we have a hashtag LA Protects, which is also the name of the initiative we have with our local apparel industry and designers that are doing everything from 3D printing of both medical and everyday folks' needs for protection. But if you go to that hashtag LA Protects, you'll see already thousands of people that are sharing their stories, their pictures, some of the patterns that they have, and other ways that they are helping to join with this movement. Before we close tonight, let me update you on a few brief things. Dr. Ferrer is going to stay for questions as well, and then get back to work up the hill as well while I speak Spanish. But I want to update you on a couple other things as well. 2 nights ago, I let you all know that through our Department of Building and Safety of the City of Los Angeles, we had new guidelines for construction sites to ensure that employers and workers are safe and protecting public health. And tonight I can report that the new measures and guidelines are running smoothly. Yesterday, Building and Safety Department made inspections at 1,912 construction sites. This is an unprecedented effort, and I want to thank all of those inspectors who are frontline workers, these folks who have been out there from the Department of Building and Safety, for mobilizing to ensure the health and the safety of workers and our wider city. Guidelines are posted at ladbs.org. That's ladbs.org. And I encourage all construction employers and workers to visit the site and to learn more. And if you've already had an inspection, visit the site again to make sure you are continuing to comply with these rules. We will not be shy about shutting down work sites that do not comply with them. So make sure that you not only read them, but you implement that guidance. I know this crisis has been particularly hard on students and their parents across the region, and I want to thank LA Unified School District for all that they continue to do to provide nutrition, to provide instruction, and to provide technology, which I know they're making moves on moving forward. Today, I wanted to remind folks that LAUSD operates 63 grab-and-go food centers at school sites, and yesterday, for instance, distributed more than 435,000 meals. Well done, and thank you on behalf of a grateful county. Beginning Monday, April 6th, the new grab-and-go center hours are going to be 8 a.m. to 11 a.m. So if you want to find the location nearest to you, if you haven't availed yourself, it doesn't matter whether you're an LAUSD student, it doesn't matter whether you go to public or independent schools, you can avail yourselves of this, and there is food for everyone. So go to achieve.lausd.net/resources to find out where those locations are closest to you. And today, the district also launched a phone hotline for students and families where they can talk to counselors and mental health professionals. I know as a father, this is a tough thing for children to go through. They're confused, they have a lot of questions, and COVID-19 can be very scary. So there's no shame if we need help managing that anxiety or that fear. And that hotline is open 6 a.m. to 6 p.m. on weekdays. That number is 213-241-3840. And I'm grateful to Superintendent Buettner, to the entire board as well, and to the entire LAUSD family for stepping up during this crisis. From helping to close the digital divide by providing devices to students working from home, from donating 100,000 N95 masks to local hospitals to deal with the shortage that Dr. Ferrer mentioned. You are all saving lives. And we are all doing everything we can to save lives and livelihoods as well. And I was very pleased to hear Governor Newsom today announce that the state is putting $50 million into the state's Infrastructure and Development Bank, known as the iBank, for microloans to our small businesses, especially those that are not eligible for the Small Business Administration loans coming from the national government, including also undocumented immigrant entrepreneurs who themselves own businesses but would not qualify for federal assistance. Here in Los Angeles, 63% of new businesses are started by immigrants. And we know that immigrants aren't just a strength of Los Angeles, they are Los Angeles. So thank you, Governor Newsom, like our programs that do not discriminate based on who you are, we want to keep our businesses alive during this critical period, and we know how many of you are suffering. The governor also announced that small businesses would be able to defer paying up to $50,000 in sales tax that they've been collecting for the state, and that these bridge loans will come with no interest or late fees. So if you're a business, avail yourself of that. And finally, there's $17.8 million in new state initiatives on the way to California workers that are impacted by COVID-19, with $7.8 million going to the LA region here to provide workforce development and supportive services to struggling Angelenos. That's everything from job training, help with rent and utility bills, to food and transportation. These actions are on top of the governor's thoughtful move to grant a 90-day extension for small businesses to pay sales tax. So thank you, Governor Newsom, for those lifelines that are helping our LA businesses. We need to keep businesses alive during this period because they don't just power our economy, they keep our people alive by providing the means to put food on the table and health insurance to stay well. And just as a reminder, Covered California has extended its special enrollment period through June 30th. So go to coveredca.com, that's coveredca.com, if you're uninsured and eligible to obtain health coverage due to a job loss or another life event. We know this is a challenging moment. We see the peril in the jobless claims. We see it in the faces of friends and family members over Skype and Zoom. And we see it and we feel it ourselves. So I just want to close, as I always do, by thanking you for your strength, for your love, for what you are doing to breathe hope into our city in this dark time. Angelenos, Californians, Americans are tough. We are resilient, and we will see this through. So stay safe, stay healthy, and stay home. Strength and love, Los Angeles. With that, we'd be happy to answer questions. Thank you.
First question comes from the line of Jory Rand from ABC News. Please go ahead.
Hi, good evening.
Yeah. Hi, good evening. Thank you, Mr. Mayor and Dr. Ferrer. I just had a couple questions on testing and one on masks that maybe Dr. Ferrer can answer. 12 days ago, Governor Newsom announced surveillance testing in 3 counties, including LA County, just random tests that gave us an idea of the number of asymptomatic people out there. Is that still happening? Will that pick up again? For those reserving spots to get tested, do they still have to be symptomatic to get a test? And are we closer to a point when that will change where anyone who wants a test can get a test? And finally, for Dr. Ferrer, it wasn't recommended that people wore masks going out until it was realized that asymptomatic patients could spread the virus. Is COVID-19 different than other coronaviruses like SARS and MERS, that it can be transmitted without showing symptoms? Is that what made a difference, or could we have known earlier that this could have helped the spread? And do you think going forward, guidance will change for wearing of masks for simple things like influenza? Thank you.
Thank you. So the first one, and Dr. Ferrer may add something to the first question as well. I've talked to Governor Newsom about this, and we do want to see, and there are many plans to move forward. LA County is also working on a study to go out there and to be able to see what the incidence is. Of course, we don't have enough tests as it is, so to answer your second question, it still is folks with symptoms who are the most vulnerable, or folks that are working in healthcare or as first responders. That's what still are the qualifications to get through a test, somebody with extreme symptoms or somebody with those underlying conditions of a certain age, and or first responders and healthcare workers. But with few tests, we don't have a lot to put into those efforts. There was one study that was done that I believe was in Santa Clara County, a little bit in Los Angeles County and Orange County. Up in Santa Clara County, it came back with 11%. But those numbers, again, it's a small pool. There could be a huge margin of error there. And those aren't the sorts of numbers that I think we have seen yet here in Los Angeles. But there are a number of efforts to move that forward. If Dr. Ferrer wants to add anything else to that or to the third one about COVID-19 and its differences, I'll turn it over to her.
Thank you, Mayor, and thanks so much for that question. Yes, I mean, obviously this coronavirus is a novel coronavirus. It's new, and it's doing some things that are different than what we've experienced with SARS in particular. In general, people who are asymptomatic are lousy spreaders of a disease. They wouldn't really account for the majority of spread. I think that why it's important for us to acknowledge that asymptomatic people, even if they're lousy spreaders, when there's so much vulnerability in a community, as there is with us, because none of us really have any immunity for COVID-19, we have to pay attention to everything we're learning. And if asymptomatic people are able to, in fact, spread, even if they're not the ones that are going to spread the most or to the most people, we have to do every single thing we can right now to slow the spread. And that means acknowledging that asymptomatic people could be responsible for some of the spread. The social distancing is really, really important. The washing your hands is really, really important. And at this point, we would also recommend that when you're out and about, particularly if you're going to have contact with other folks, you should cover your nose and your mouth. But I do think that this is very different than what we saw with SARS. And again, this is a learning journey, deep appreciation for the researchers and scientists that keep digging to get us good information so we can make better decisions about what tools we ought to use to really slow the spread. But thanks a lot. Oh, the seroprevalence study, yeah, it was a very small number. We are looking to do another seroprevalence study, and actually the best way for us to do this would be to do this at regular intervals, so to do it sort of every month so we could see what seroprevalence is doing and how it's changing. But I do think we need to do it for a larger number of folks in order for us to really get a sense of what's going on in our community. So we're supportive of all the efforts. I know we're actually working with the city to make sure that we've got some good studies moving forward on seroprevalence. And just a reminder to everyone, the test that you do for seroprevalence is not the same molecular test that we do to find out if you're positive and infectious. So the seroprevalence just says you have some antibodies inside of you that show that at some point your body saw COVID-19 and mounted a response. So it doesn't really say whether you're infectious at this particular period of time. So I just want to make sure people don't confuse the testing that really shows whether or not you're a person that's carrying the infection and capable of infecting others versus seroprevalence, which really is an antibody test that just tells us, did your body see this virus at some point in time? Thank you.
Thank you. We'll take the next question. Thank you.
And our next question comes from the line of Alex Michelson from Fox 11 News. Please go ahead.
Hey, Alex.
Hi, Mayor and Dr. Ferrer. Good to have you with us as well tonight. I'm wondering, how do you define first responder when it comes to the N95 mask? Is it only people in hospitals, or does that include firefighters, police officers, the media, grocery store workers, other people that have to go to work every day? And also, if you're going for a run, which so many people are doing these days, should you be wearing a face covering while you do it?
So first responder, the way I use it, is just talking about those firefighters and police officers that are coming in direct contact and folks that are working, for instance, in our shelters. We know there are other frontline workers, which I've used that term. Those are folks, for instance, the grocery clerks, people working in pharmacies. But first responders are not medical personnel. Medical personnel are their own category. They're definitely at the top of this heap, together with some of the first responders that essentially do medical work, like our paramedics and firefighters. Those are ones who absolutely medically need the medical protection. And for the general public, they need a face covering. There may be some in between, as Dr. Ferrer said. We, for instance, got some of those surgical masks early on to help some of the grocery store workers that were on the front line and others that may be really right in the firing line. But no, first responders are really public safety professionals. Medical workers themselves are different, but both of them, to different extents, are using those N95 and surgical masks. I don't know if you want to add anything else.
The mayor was absolutely right. I mean, the reason you use an N95 is you use it when there's the chance that this virus can be aerosolized. And so there's a very defined list of procedures that are done that could, in fact, aerosolize a virus. And they have to be done by a trained medical professional. Sometimes, in fact, our paramedics are performing some of these procedures, and that's why they sometimes will need an N95 mask. And certainly in the hospitals, we have many healthcare workers that are going to perform procedures that would require the N95 mask. The rest of the healthcare workers really need those surgical masks, which is why I'm saying, no run on either N95 or surgical masks, because our healthcare community is using both and using them appropriately. But we need other people not to go ahead and order them, which will limit even further the supply that's available to those that need it. I can address the face covering on the run. If you run by yourself, there's no need for a face covering. If you're running with other people, first of all, please keep your distance. But if you're going to stop and have a chat with somebody and you're going to spend 1 or 2 minutes having that conversation, cover your nose, cover your mouth whenever you're having conversations, particularly if you're not able to do the social distancing of 6 feet. But no, I think if you're running by yourself, you're fine to just go ahead and do that run.
Next question, please.
Our next question comes from the line of Christine Myduke. Please go ahead.
Hi, Christine.
Hi, Dr. Ferrer. Hi, Mayor. Thanks so much for taking our questions. This is more directed toward Dr. Ferrer. You mentioned earlier this week that it might be 2 to 3 weeks before LA County hits its peak. So to say, according to your latest modeling, and you also said that you might have some more information at the end of the week about that. You also reported today the highest number of new deaths in the county to date. Do you have any update, or can you give us a sense of what the modeling you're looking at is showing, whether that's showing an improved picture from what you might have been looking at a few weeks ago? Is there any evidence that the social distancing is making a real difference? And do you feel comfortable saying that the curve has started to flatten here in LA County? And I'm happy to hear from Mayor Garcetti as well on that.
Those are great questions. I wish I could give you definitive answers on, when's the peak and have we flattened the curve. I definitely know that everything we're doing is going to have an impact. And I'm hopeful, as all of us should be, that we're taking every step possible to, in fact, flatten the curve, slow the spread. We won't actually know definitively how successful we are for a few weeks. As we increase testing, we're going to increase the number of positive people. So from a testing aspect alone, if you assume that somewhere between 10 and 12% of people who are tested, which is where we're at now, are going to be positive, and you do many more tests, you're going to identify many more positive people. The other thing about this is the more people that are in fact infected, the more likely they are to be spreading to other people. That's why the social distancing, the isolation, and the quarantine are so important. On average, with COVID-19, an infected person is infecting 2 to 3 other people. The way to slow the spread is to actually make sure that every person who's infected does not infect 2 to 3 people, but reduces that number to something much less, more like 1 to 2 people, and ideally less than 1 at some point. That's how you actually will slow the spread. But in the meantime, because of the testing effect, we're going to continue to see an increase in cases. Our job is to slow the spread enough while we see the increase in cases and while we have more cases of people being positive to not overwhelm our healthcare system, not have such a steep rise over such a very short period of time that our hospitals become overloaded and can't care for everybody who needs their help. And I think with everyone's help, we're on a good trajectory to be able to do that, but I don't have the definitive answers about whether or not that's what the data is showing. We'll need to go through this for another couple of weeks, and then we'll be able to see. Our mortality rate right now, the number of people that are dying, is at about 2%. But remember, with limited testing, we're not capturing everybody who's positive. So again, we need to continue to do the testing. I applaud everyone's efforts, the mayor's efforts, the county's efforts, to increase that capacity, because that really helps us identify people who are positive. We're able then to ask those people that they have to isolate and they have to quarantine their close contacts, and that's the way you get that number down from every infected person infecting 2 to 3 other people on average. But thanks for the question.
Thank you. And I'll add very, very briefly to that. Statistics are tough, and we don't have enough time to look, enough time in this crisis, to look at really long-term trends. This week, I'll say that though, the last 7 days have had less of a rate of increase than the previous week. So we were looking at a doubling every 3 or 4 days. Now that's 5 or 6 days. So that's a good sign because we are doing more testing. Those numbers should be coming up with the testing. And the fact that we're doing more testing and seeing that come down a little bit, I think speaks to the power of what everybody is doing. But don't take that as news to let up. That is exactly when it starts to feel right that we have to continue doing the things that we are doing right now. When people say, well, now can't we just go back to things, that's exactly when we have to have the tenacity to see this through, because as we saw in other countries that did flatten the curve for a moment, sometimes they would spike up again. So please stay with it. Next question, please.
And our next question comes from the line of Conan Nolan from KNBC TV.
Hey, Conan.
Go ahead.
Mayor, if you wouldn't mind putting on your Metro hat as the vice chair of the board.
Sure.
I understand that Metro has, as of yesterday, confirmed 14 cases of COVID-19 of employees, including a driver out of downtown, a driver out of Boyle Heights, a driver out of Paramount. I'm just wondering if that figure changes, could change the dynamic on what routes remain and what routes will be prematurely ended, at least temporarily, or whether you factored in this kind of attrition as the disease starts to spread.
Right now, Conan, thank you for the question. We feel very strong about our capacity to be able to deliver the public transportation that we've promised, which has been reduced because there are fewer riders, but is still absolutely critical to some people who it's the only way they can get to their medicine, only way they can get to food, and of course for some of our hospital and healthcare workers, that's what they depend on to get to work. First of all, and if you haven't seen the video, there's a beautiful video that's been trending nationally that thanks all of our Metro employees who are wiping down stations, who are driving those buses, who are doing everything they can to make sure that critical people can still get to their critical work. And I want to thank them. Those numbers, though, for a very large workforce are absolutely still manageable. I update folks on the LAPD and LAFD numbers now each night. And as I mentioned, I think there were 30 LAPD officers, 35 LAPD and 10 different LAFD workers, both civilian and sworn. But we also have 120 LAPD folks who right now are quarantined because of potential exposure. So more than even the folks that have tested positive, we do see some workforce, but that's absolutely manageable right now from LAPD, and for Metro, quite manageable. But our hearts are with each person who is struggling with this. We are with you. We want you to get well. We are there for healthcare, and we're going to continue delivering people on our buses and trains. Thanks. Next question.
Our next question comes from the line of Claudia Prosciutto. Please go ahead.
Hi, Claudia.
Hi. I am wondering, given the fact that testing remains limited and that results in some cases can take several days and that people with more mild symptoms may not even be getting tested at this point, can we get numbers on presumed cases that are being reported to the public health department by doctors to get a better idea of how widespread the virus actually is in the county? And I'd also like to know what public health is doing to make sure people who've tested positive or are presumed positive are self-isolating. Are they getting daily visits or calls or texts? And then does the tracking begin when a doctor reports a presumed case or only once a lab test confirms that a person is actually positive? Thank you.
Yeah, those are great questions, Claudia. Thank you. So let me just say that presumed cases is a very big category. And I'm going to point to the data on testing to explain why it would be very hard to follow up for us on every single presumed case. As I noted, only 10 to 12% of folks who are tested, which as you know, those are folks who are ill, and many of them fall into the category of a presumed case, only 10 to 12% of them are actually positive for COVID-19. The vast majority of people who are tested are still not positive for COVID-19. So I want to remind us that we have a very large number of people who may be presumed to be cases, but once they get tested, they're actually not positive. We have issued guidance, however, that says if you get tested, you should, from the point you go in and get tested, presume you are positive, and that's when you should start to isolate yourself. If you get your test results and you're negative, That's great news. You should still stay home if you're sick and you have symptoms. But if you don't, then you're free to go about your business. In terms of our work, though, following up with people who are presumed to be positive, that's very limited, because as you noted, there's many thousands, tens of thousands of people who are getting tested because they're presumed cases, and the vast majority aren't. So our staff at the Public Health Department is not able to follow up with all of the presumed cases. But what we do is we try to follow up with all the confirmed cases. And this in and of itself is a mammoth task when we have over 4,000 cases and the number rises by 500 or 600 every day. But what we do try to do is once we get a positive result, we try to make sure we can find the contact information. And I have a team of about 350 people that spend their day trying to call people and talk with people to make sure a couple of things. One is they understand what it means to isolate themselves, and we find out if they're able to do so or they need any help. The second thing is we need to find out if they have any high-risk contacts who they came in contact with, or if they're a high-risk person themselves. High-risk contacts would be people who work in our healthcare facilities, in our shelters, in our congregate living facilities, in our nursing homes, people who work with very vulnerable people doing home care. We want to know about those contacts because we want to make sure those contacts are quarantining themselves. But this is a huge task, and it's difficult. We don't always have good contact information from the reports that come back from the lab. But I want to really express my gratitude for having a team at Public Health that continues to do what we call case identification and contact tracing. Because we also have another team of another few hundred people that also investigate every single case that happens in an institutional setting. So at the first sign that there's a positive case in an institutional setting, we have a team of folks that will follow up to try to make sure that we limit spread, particularly in those settings where there are lots of vulnerable people, nursing homes, assisted living facilities, shelters. So that's really, at this point, more than 700 employees at the Public Health Department that spend their entire day and evenings trying to make sure that we're able to communicate and help people do the isolation and do the quarantine and really shut down outbreaks as much as we can in institutional settings. Thank you.
And if I may, I know the doctor is too busy fighting the fight to say this, but let me say this as an American. We have to invest in public health. We have to invest more in public health to be able to do things like we see in other countries where you can chase down folks who might be symptomatic. We just have disinvested in this across this country, and I think it's a lesson for all of us. Public health labs are critical. Public health is absolutely critical, and we have to be able to surge that, as well as, of course, our medical stockpiles separate from public health. But I hope that those are lessons when it comes to budget time for our national leaders to listen to, as well as anything that we can ever do, of course, in the state and locally. Next question, please.
Our next question comes from the line of Steve Gregory. Please go ahead.
Hi, Steve.
Hi, Mr. Mayor and Dr. Ferrer. I know it's been a long day for you. Mr. Mayor, I apologize if you've mentioned this before, but
Sure.
regarding your LA Protects program
Yep.
and the face coverings, the partnerships you have with the garment industry, did you talk about how those were going to be distributed, how people are going to get a hold of those, and how much they're going to cost? Also, do you have an update, you or Dr. Ferrer, on how the USNS Mercy is being utilized, how many patients are there now, the status on the convention center and field hospital situation? And I also want to know, Mr. Mayor, if you have a comment on the well-documented situation between LAPD and some partygoers in Hyde Park a few days ago that had to break up a party, and do you think that's a sign of things to come as the stay-at-home order continues on, that tensions continue to rise and things like that are going to keep happening? Thank you.
Let me start backwards. I think we'll have incidents like that, but no, we have not seen tensions rising. We've actually seen crime plummet. We've seen, as I mentioned, traffic accidents and other things go way down. And by and large, not only is social fabric holding, but actually growing stronger. We're seeing those acts of generosity up as acts of crime go down. But wherever we see folks who are flagrantly violating the stay-at-home orders, we'll go after them. It's important for our health. It's important for their health, quite frankly, as well. Going to a party can kill you. Being in these environments can harm somebody that you love. Working backwards, In terms of the Mercy update, I don't, and I don't know that Dr. Ferrer would have those numbers either, but we'll try to get them for you, Steve, from the Navy. And in terms of the LA Protects, so LA Protects is a number of things. It is working with our local manufacturers to provide both face covers for the general public as well as medical grade equipment for our medical personnel. For this stuff, it's everything from designs you can use at home. It's letting people know how they can take a bandana and safely be able to effectively cover your nose and mouth, not just letting it droop down with an opening here. Kind of hacks that you can do at home, as well as products that will be out there. I authorized, for instance, the purchase of 30,000 of these masks. Folks that had been working with us, I think this is the one that I used last night. These are great masks. They had been donating them. Couldn't keep donating them, and I said, well, I want to buy them for the city employees, so we're purchasing 30,000 of those that we'll also share with people who are working in settings that need them, as well as everyday city employees. Those will be available for the general public. They're not terribly expensive, but you don't need to have money to buy one of these. You can actually put these together effectively. These are not, somebody wrote today on an email, hey, are you wearing your mask at home? Why aren't you wearing it all the time? This is when you head out and when you are going to be interfacing with other people where you're close enough to be able to potentially have your droplets come into their area. That's what this is about for LA Protects. And I think there was a fourth question stuck in there. Oh yeah, the convention center. It was good, Steve. You got 4 questions in one. The convention center had a great meeting today. The state is being very helpful. The county and the city, everybody working together. There had been some initial plans to maybe look at the forum. I think the state now is saying this is their top priority in the state for a kind of spillover area or a place to put more beds. 250 beds are already up. And that was thanks to the California National Guard. The county has been giving just marvelous guidance and cooperation with this. The city's offering to do whatever muscle we need. We're not medical experts, but we will add whatever muscle to this that is needed. But it is not open, it's not needed yet, but we feel very secure that should we need to use that in the coming weeks, that we will be prepared sometime next week.
Thanks, sir.
Thank you. Next question.
And our last question in English comes from the line of Steve Futterman from CBS News. Please
Steve.
Go ahead.
Hi, Mr. Mayor. I want to ask you a question on the masks and a couple follow-ups. The masks, there have been some compelling reports out of the Czech Republic where they've actually made wearing masks mandatory, that it is having an impact. And I know you're strongly suggesting people to wear masks. Why would you not make it a mandatory order to wear the masks? My second question is, are you trying to use private channels, maybe a type of espionage of plan to find ventilators that the county or the city can buy to provide hospitals with more ventilators when they might be needed? And finally, you raised the issue about the non-essential businesses which you've been finding may be operating. Have there been any citations or any legal action taken against any companies like this yet?
Let me start with the second one. So procuring ventilators, we actually have been working very strong. We've been using, as I mentioned, I think a couple nights ago, the head of our port, so Gene Soroka is now the Chief Logistics Officer. He's in contact through our office with the Hospital Association asking for their needs. As we saw, ventilators went up, the number that were available since yesterday. The governor's been very helpful. Federal government has sent some. We've had to make some adjustments to those, but those are coming back down to Los Angeles. But no, there's no, I'm not sure what the espionage question was, but nothing secret, no dark arts, just the normal things that everybody else is doing, but very aggressively talking to anybody. We get probably 5 to 10 emails a day just on ventilators where people say, I know somebody, I have a contact, I make them. So we're taking medical professionals to know the difference between different types of ventilators. People are selling all sorts of things out there. They're being sold for all sorts of crazy amounts of money. And so we're making sure professionals sort through that. And anything we can do to get more, yes, we are doing that. In terms of legal action on businesses, there's been 8 that have been referred for criminal prosecution, but because even that takes time and we have courts that are closed, we also said yesterday moved forward with Department of Water and Power being able to shut off people's water and power. Some of you asked last night if I could name some of the businesses. I can't name the particular businesses, but the type of businesses. For instance, we had a smoke shop that just refused to close. And even when police officers were there, they said, forget you, probably in not as nice words. We're not going to do it. And so we're moving to shut off their power and their water. We want that people know that we are serious about this, that businesses that flagrantly violate this will be shut down in the short term and prosecuted in the medium term as well. And in terms of mandatory masks, we thought that we should start with this. There's no place in the country that was even recommending it yet. I'm glad that Los Angeles, like California, is on the leading edge of this. And as Dr. Ferrer said, even if it's for a small percentage of spread, it is worth it. But in terms of mandating, we want to produce these first, have enough out there, try to get as many to the public. And as we get more of these, we'll see if we can't get folks to help us with this. And I always appeal to folks that are watching out there for your assistance. And I want to appeal for two things. In the future, if you're interested in helping get more masks, or we want to call them facial coverings to distinguish them from masks, but facial coverings for the general public, let us know. And through the Mayor's Fund, we're happy to try to buy as many of those. The local manufacturers think they can make as many as 5 million of these a week. That would cover LA County, every resident, in just 2 weeks if they're reusable and washable. Second, Dr. Ferrer mentioned about the studies that the county is doing and that we're trying to assist with. The prevalence studies, they cost about $50,000 to do each time. If there's anybody out there who would like to pay for, we're trying to maybe do this as many as 8 different weeks. We would love to get that sponsorship. It would be only $400,000 that would allow us to go every single week for 8 weeks. We're looking everywhere for those monies, but it's something that I'd like to directly appeal for to help Dr. Simon, who works with Dr. Ferrer on these studies. All right.
Thank you.
Thank you. Anything you want to add on any of that? Okay. That was the last question. I hope you will all join me in thanking Dr. Ferrer and allow her to get back to work. Thanks, and I'll switch over to Spanish in just a second. Thanks. I'll let you safely pass. Thank you. Man. That was great. Thank you. All right. Okay. 3, 2, 1. Buenas tardes, Los Ángeles, y gracias por venir a la alcaldía de la ciudad de Los Ángeles. Y hoy estuve con doctora Ferrer, directora del Departamento de Salud Pública del Condado, pero yo quiero dar mis gracias a ella, a todo el equipo del condado y las otras ciudades en el condado de Los Ángeles. Somos un equipo unido y con la gente de Los Ángeles estamos luchando para parar esta crisis de coronavirus, de COVID-19. Y estoy agradecido con el condado por su colaboración con nosotros. Hoy en el condado de Los Ángeles hubieron 534 casos nuevos. En total tenemos 4,045 casos. En la ciudad de Los Ángeles hay 207 casos nuevos y un total de 1,787 casos. Fallecieron 11 personas, un récord, desafortunadamente, en el condado hoy. Y ahora son un total de 78 en total. Estamos profundamente tristes y nuestros pensamientos y oraciones están con las familias de los fallecidos esta noche. Hoy hicimos 2,100 pruebas de detección. En total hemos hecho 14,400 y la semana que viene llegaremos al 30,000. Tenemos 9 sitios públicos para pruebas en el condado, no solamente en la ciudad ahora, incluyendo 7 en la ciudad y 2 más en el condado. Visite la página coronavirus.lacity.org para saber si es elegible para hacerse una prueba ahora. No necesita vivir en la ciudad de Los Ángeles para recibir una prueba. Sabemos que muchos están haciendo lo necesario para aplanar la curva. Vimos que bajaron los accidentes de auto el 59% desde que implementamos la orden de más protegidos en casa. El Departamento de Transporte está lanzando un nuevo servicio para instalar gratis letreros cerca de restaurantes para establecer zonas de parqueo temporales para personas recogiendo su comida para llevar. Restaurantes pueden aplicar para obtener un letrero en ladot.lacity.org/pickup zone. En nuestros hospitales tenemos 1,664 camas y 1,050 respiradores. Seguimos trabajando con proveedores para obtener más. Para apoyar a nuestros hospitales, la construcción del centro de convenciones como una estación médica federal nos ayudará. Y el buque USNS Mercy ha empezado a admitir pacientes durante esta semana. Quisiera también decir unas palabras acerca del atentado contra el buque en nuestro puerto ayer. No existe ninguna excusa para justificar ningún tipo de ataque contra el buque Mercy o cualquier otro lugar. Esta nave no está aquí para causar daño, está aquí para ayudar y curar. Anoche anuncié la recomendación de que Los Ángeles lleven coberturas faciales cuando salgan en público para hacer tareas esenciales. Estudios indican que esto puede disminuir el contagio del virus por personas que no tienen síntomas. Noten que estas no son mascarillas médicas. Esas son para proteger la vida de médicos y enfermeras. Lo que recomendamos al público son coberturas de bufandas o bandanas o pañuelos. Y solo está efectiva esta medida junto con las otras prácticas como lavarse las manos y mantener sana distancia. Todos deben mantener sus caras cubiertas en Los Ángeles. Además, desde que anuncié la nueva guía para proteger a los trabajadores en obras de construcción, el Departamento de Construcción y Seguridad ha inspeccionado a 1,912 obras en construcción hoy. Y gracias a los trabajadores del departamento por su visión, su trabajo y su cariño. Visita la página ladbs.org para conocer las reglas en sitios de construcción. Es muy importante, especialmente por los trabajadores. Los sitios que no están actando en conformación de nosotros pararemos su construcción. Además, el distrito escolar ha abierto 63 sitios para recoger comidas y ayer distribuyeron 435,000 comidas. Gracias a nuestros hijos, y no se importa si su hijo está en el distrito de LAUSD, es por todos los niños en Los Ángeles. Para encontrar un sitio cerca de ti, visita la página achieve.lausd.net/resources. También abrieron una línea telefónica para apoyo de consejeros y profesionales de salud mental. Es muy difícil para nuestros hijos. Como un padre, yo sé, es difícil. Si necesita ayuda o su hijo o hija necesita ayuda, llama a 213-241-3840 para un asistente, profesionales que puedan ayudarte. El gobernador Newsom anunció hoy que el estado estará agregando 50 millones de microcréditos para empresas que no son elegibles para préstamos de la Administración de Pequeñas Empresas. Además de $17.8 millones para apoyar a los trabajadores de California afectados por COVID-19, con $7.8 millones dedicados para la región de Los Ángeles. Y les recuerdo, Covered California ha extendido su periodo de inscripción especial hasta el 30 de junio. Visite el sitio coveredca.com si necesita seguro médico. Estos son momentos difíciles para todos nosotros. Me siento increíble las acciones de angelinos cada día a proteger nuestra ciudad, nuestras familias y nuestro mundo. Por ahora sabemos que tenemos que hacer cada día. Quédense protegidos, quédense en buena salud, quédense en casa. Mucha fuerza y mucho amor, Los Ángeles. Y con esto, preguntas. Take the first question.
And our only question on the Spanish line comes from Leon from Univision. Please go ahead.
No puedo escuchar mucho, pero creo que fue una pregunta de nuestros desaparecidos. Son unas palabras de esto. Gracias, León. Estamos haciendo todo lo posible para proteger a nuestros vecinos sin hogar durante esta crisis. Tenemos más de una docena de sitios que está ofreciendo pruebas de detección para esta comunidad. Y estas pruebas empezó hoy. Es muy importante para mí porque estos son los más vulnerables de la población. Y tenemos 900 habitaciones en hoteles y moteles para que personas infectadas puedan estar en cuarentena. Y este es muy importante también porque estas personas no tienen un hogar, pero estos moteles y hoteles son santuarios para estas personas. Y tenemos más de 300 estaciones con lavamanos por toda la ciudad, nuevos baños en las calles también, porque es muy importante por su sanitación también. Y contamos con más de 500 casas rodantes, llegando a sitios como nuestros parques. Estos son por la isolación y cuando necesitamos tener una persona con COVID-19, estos son los lugares para ellos. Pero es muy importante continuar porque este virus, las personas en las calles son las personas más vulnerables y también necesitamos la ayuda. Pero gracias al gobernador Newsom, gracias a la administración en Washington, el trabajo del Congreso, tenemos más de 50 millones de nuevos dólares. Pero necesitamos encontrar más y más y más hoteles y moteles ahora. Es mi visión, mi sueño, a tener 15,000 habitaciones para las personas en las calles. Finalmente, el centro de convención es un lugar donde nosotros podemos poner a la gente, por ejemplo, de Skid Row o otros lugares, y ahora será un hospital para ellos con otros miembros de la comunidad. Gracias. ¿Uno más? Take another question?
One moment, please, while we gather the names.
Okay, thank you. All right, I think it's all right if you don't have the name. You can just ask the question. It's fine.
We do have a question from the line of Gabriel Herta from Telemundo,
Okay.
LA.
Hola, Gabriel.
Please go ahead.
I have two questions. First one is if the city has any plan in relation to the transportation services.
Sí, sí.
Will the metro or the bus service be suspended or reduced in the next day? We know some cities like Carson are already doing something like that. And the second question is, we know that there are many restaurants in Los Angeles that are closing the doors and transforming their businesses into small stores. Does the city have programs or plans to offer them some kind of support?
Sí.
Thank you so much.
Gracias, Gabriel. No tenemos planes para cerrar servicios de transporte público con LA Metro. Es importante continuar a proveer este servicio a los trabajadores en nuestros hospitales, a los oficiales del Departamento de Policía, bomberos, otras personas que necesitan trabajar y que dependen en estos servicios. el autobús de la ciudad de Los Ángeles, Dash, es gratis durante esta crisis. Hay reducciones en servicio en el Metro, Dash y otros sistemas, pero no hay planes a cerrar. Este es crítico, pero estamos lavando las estaciones, los autobuses, etc. Y gracias a todos los trabajadores de Metro, de Dash, el Departamento de Transporte de la Ciudad de Los Ángeles y otras ciudades, por su valor, su coraje durante porque ustedes están dando a la gente de Los Ángeles no solamente una poca de esperanza, pero acceso a la comida, acceso a sus medicinas, etc. Es muy, muy importante. Segundo, por el apoyar de nuestros restaurantes están sufriendo mucho durante esta crisis y estamos haciendo todo lo posible para protegerles y también asistirles. Ayer anuncié que tomamos acción con el condado para permitir que los restaurantes puedan también ofrecer productos comestibles en sus menús para llevar. Si hay un restaurante que tiene ese servicio para llevar, ahora es legal para también dar estas comidas o productos comestibles también. Y espero que puedan dar un poco más asistencia durante esta crisis a estos restaurantes y mercados. Aunque no puedan aceptar clientes en sus restaurantes, esta forma de innovación, en mi opinión, este momento les ayudará a sobresalir. Gracias por sus preguntas y gracias a toda la gente por sus acciones y mucha fortaleza, mucha fuerza y amor. Adiós.